I'm Angie and I'm a midwife and a health visitor with over 10 years of experience working with families, offering support and guidance with their parenting concerns. Colic affects 1 in 5 babies postnatally and is defined as inconsolable crying in an otherwise developing, healthy and thriving baby gaining weight postnatally. And it's important that you seek professional healthcare support from either your GP or health visitor if you suspect that your baby has colic, as there can be many causes for this postnatally. Colic is defined by healthcare professionals as crying for 3 hours a day or more, for 3 days a week or more, for 3 weeks or more postnatally, and it can affect babies anywhere from newborn onwards. The symptoms of colic include inconsolable crying, bringing their knees to their chest, arching their backs, and having flushed cheeks. One of the many causes for infantile colic postnatally can be temporary lactose intolerance. Lactose is the sugar that's found in both breast milk and formula milk, but for some babies with their immature guts, they struggle to break this down, causing them the discomfort and causing the crying postnatally. Here are my helpful tips with how to manage a colicky baby. So firstly, whilst it might be distressing, understand that it is really common, and keeping calm wherever you can do is really important. Taking a few deep breaths to be able to manage in those inconsolable crying periods is really important. For many babies, the colic symptoms tend to appear more in the evening, and so introducing a nice soothing routine can reduce the amount of crying a baby does. In addition, you can try some of these settling techniques to see if they work for your baby. So firstly, try a range of different positions, either upright and over your shoulder and nice and close to you, or you can try a tiger in the tree hold over your arm. Rocking, swaying and moving with your baby has also been shown to lower the amount of crying a baby does. And of course, you can always try a different winding technique as well with babies where they're slightly angled on you. Moving your baby around in a pushchair or a pram, or going out in the car seat can also be beneficial for babies with colic. And also you can try wearing your baby in a sling. And in a sling, they are close to you, they're listening to your heartbeat, so they often find that there is less crying in a sling and being baby worn. In addition, you can try things like white noise, pushing the vacuum cleaner around, or things like putting them near a washing machine in a safe space as well. For some babies, a warm bath can help, as can baby massage. If you are bottle feeding, then trying an alternative teat flow might help find a more comfortable feed for your baby, and you can try paced bottle feeding. If you are breastfeeding, then keep a diary to see if there are any dietary links between what you are eating and the colic symptoms. Finally, you can try Colief Infant Drops. These contain lactase, which help to break down the sugar lactose into more simple sugars, galactose and glucose. What this does is help provide more comfort for your baby. They are suitable from birth and they can be used with every feed.